Imricor is a U.S.-based medical device company. We're located in Burnsville, Minnesota, which is a southern suburb of Minneapolis. And our goal really is to revolutionize the treatment of cardiac arrhythmias by allowing doctors to perform cardiac ablation procedures that are guided by real-time magnetic resonance imaging rather than by X-ray fluoroscopy the way they're done today. And we don't make the MRI systems themselves. We make the interventional tools that are uniquely compatible with those MRI systems. And in this way, doctors can perform the procedures that they do today, but they can do them while taking advantage of the improved imaging that MRI offers. And we're here today in our ICMR Design Center. That stands for Interventional Cardiac Magnetic Resonance Design Center. And in this design center, we test our devices, we integrate our systems with the MRI, and we can demonstrate our products. And this lab is very much like the ICMR labs in hospitals where doctors perform procedures with our devices. In a normal heart, electrical waves flow through the heart and create each heartbeat. And when these electrical waves are disrupted or rerouted by abnormal heart tissue, the result can be a heart rhythm that is too fast or irregular, and that's called an arrhythmia. Types of arrhythmias include atrial fibrillation or AFib, ventricular tachycardia, atrial flutter, and of course there are more and more. In a cardiac ablation procedure, a doctor guides a catheter into the heart and selectively burns or ablates the problem area, and that restores the normal heart rhythm. Today, ablations are performed in X-ray labs, meaning that the doctor uses X-ray imaging to see where their catheters are in the heart. The trouble is the heart's virtually invisible to X-rays, meaning that while the doctor can see the catheters, he can't actually see the thing that they're trying to work on, the heart itself. And on top of that, when a doctor tries to selectively burn or ablate the heart, they can't tell for sure if the burn is permanent or if it's just temporary. And if the burn's only temporary, it'll later heal and the irregular heartbeat or the arrhythmia will come back again. And so for the patient, that means coming back for a repeat ablation procedure, which is really very common today. But MRI is the only imaging modality that allows us to see these lesions, to assess the ablation burns, and with the goal of making sure that the job is done right the first time, because doing so will mean fewer repeat procedures, which is better, of course, for the folks who need these procedures, but also decreased cost per patient for the treatment. We've made sure that the devices we make are similarly priced to the devices that exist today for conventional X-ray procedures. That way, doing an ICMR ablation is no more expensive than doing an X-ray guided ablation. And in addition, the lab itself, while a bit more expensive to install, has additional benefits for the hospital. When you're not doing interventions in your ICMR lab, it still houses a diagnostic MRI system. So the hospital can use that before procedures in the morning, after procedures in the afternoon, for instance, to generate additional revenue through normal diagnostic imaging. Yeah, that's a good question. This is not a new idea. It dates back to 1995 when doctors first started saying, hey, it'd be nice if we could do these ablation procedures in MRI rather than X-ray. But there are real technical challenges associated with trying to make an interventional device like catheters and other things that are compatible with MRI. And while many companies have tried, Imricor is the only company in the world to successfully make ablation devices that are compatible with MRI. And the overall catheter ablation market is estimated to be about $4 billion worldwide. And we're beginning our commercialization efforts in the EU, starting with simpler ablation procedures, atrial flutter in particular. And then we have two important ways that we can grow. First, we'll work to expand into other geographies, pursuing approvals in the US and Australia and so forth. And secondly, we'll work to expand our indications to treat additional arrhythmias so that more patients can be treated at each installation. The funds we're raising will be used to launch our products in Europe, grow our manufacturing capabilities, increase our sales and marketing teams, and also to support the growth strategies that I described earlier. This is an exciting time for Imricor. We set out over a decade ago to do something no one else had been able to do, and we succeeded. And so now we're looking forward to making a significant impact on patient care around the world by bringing 21st century technology to a decades-old procedure. And I'll tell you, this doesn't happen all the time, and it's going to be really fun to be part of something so significant and so impactful.